Hey guys, Dr. Robert Fredrickson here. Today I want to talk about some research going over COVID-19 and blood sugar. So I get asked all the time, what can we do to prepare ourselves in case of the next pandemic or the next cold and flu season? And there's a lot of people talking about, the traditional or the go-tos for immune boosting nutraceuticals. Maybe that's vitamin C, vitamin D, zinc, astragalus, echinacea. Today I'm not even going to talk about supplements. I'm just going to talk about natural ways to boost your immune system. So with this virus still being relatively new, it's still 2020, we're still learning a lot about this, but there's definitely some things that stand out, as there is a very, very high percentage of people that are surviving this. And it seems to be that the population of people that are doing worse are people that are metabolically deficient. And so what do I mean by that? There's basically a study done in China, and it was a retrospective cohort study. So basically what that means is they went back at the end of the trial and they looked at the participants. They found something very interesting. They found that participants in the study who had a high fasting blood sugar and they got COVID, their outcomes were drastically worse. They were more likely to be put on a ventilator. They were twice as likely to be staying in the hospital twice as long, and they had up to 4 times higher chance of fatality just from having a high fasting blood sugar. Now you might be saying, well, yes, diabetics always are going to have worse metabolic outcomes. Well, in this study, it was pretty interesting because a lot of these weren't even diabetics. They were more pre-diabetes, okay? So they had a fasting blood sugar, it was about 6.5 to 7. So that I think it equivalates to about 120, 130, okay? So a lot of people walking around today, they don't know their fasting blood sugar. It is a simple, easy tool to measure. You can go to your neighborhood Walgreens, CVS, supermarket. Here in Texas, we call it HEB, and you can get a glucometer, okay? Basically, it's a finger prick test, so you can test your fasting blood sugar in the morning. If you're anywhere over 100 upon waking, you need to find ways to mitigate that, okay? So maybe it's getting more exercise, maybe it's monitoring your calories a little bit better, maybe it's going for a walk after exercise. Did you know that actually going for a walk after exercise can lower your blood sugar? So they've actually done a few trials, and I'll try to link some of the research here, but they've actually compared the popular diabetic drug metformin to walking after a meal. Usually it's your largest carbohydrate meal, which is dinner. They found that walking was almost as effective as metformin. And so just getting for lowering blood sugar. So just getting some exercise after a meal. I know I've lately been trying to walk my dog after dinner just to get some exercise to help me move that GLUT4, which is a molecule to help glucose get to the outer membrane of the cell to be used for fuel easier. So it's all about getting your metabolic health in order. If you are struggling or on the fence and have any questions about the best ways to do that, let me know in the comments. But as always, I'm here to share information. This is just for informational purposes only. If you have a health care or underlying condition, always consult your healthcare provider. But this is the time to figure out if, hey, I'm having blood sugar issues. I'm having signs and symptoms of blood sugar. So what are the symptoms of blood sugar dysregularities? Well, it's snacking. It's getting tired after lunch. It is needing that second cup of coffee after lunch because you're tired. It's thirsty. It's having extreme, bouts of thirst more than the normal person. It's needing a meal every 1 to 2 hours. It's that need for constant snacking. Those can all be signs of poor blood sugar control. So if you're having some of those signs, it's always good to get your health checked out by a qualified healthcare practitioner. But maybe it's just time to get some simple exercise. Maybe start walking 15 to 30 minutes after your largest meal of the day. Maybe that's lunch, maybe that's dinner. Maybe it's time to start really incorporating better choices of food. Maybe it's better choices looking up the glycemic index, trying to learn, hey, what foods are gonna have the biggest impact on my blood sugar versus another food. And so we're finding out that list can be really helpful. And so I hope you found this video informational. Hope you found it helpful in your journey to getting better health. And if you have any questions, let us know in the comments again. And I'm here for your health as always. Feel free to subscribe to my channel for more videos just like this. Thank you so much for joining in today, and we'll see you next time.